let's say the Pledge to Allegiance. I pledge allegiance to the flag, United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. Thank you. Did everybody have a chance to read the meeting minutes? Do you want a minute to look them over, or everybody? Did everybody get a chance on email? Okay, so do we have a motion to approve?
So moved.
Second.
Third. Okay, second, great. Okay, meeting minutes from last month approved, February 19th, 2019, perfect. Okay, do you want to give a health officer's report, Marie?
Sure. Good evening. So this past month, we did 24 food safety inspections, 9 pool inspections. There were, I guess since the beginning of the year, we held 5 CPR AED first aid classes here at the Township building. Over 30 residents were certified. The next first aid CPR AED class, which is a heart saver class, is scheduled for next Thursday at 7 p.m. here. We usually hold it in the roll call room down in the police station. You can register in person at the police administration. The cost is $45 now. This is part of the Wellness Wednesdays events. Orange Theory will hold their high-intensity interval training class here in the Radnor Shire room this Wednesday from 12:15 to 1. If you're interested in and want to attend this event, just reach out to Lizette in the Parks Department. Under public health concerns, I just want to touch briefly on I guess the conversation we had at the last board meeting. Just to confirm, Delaware County does not track diseases, and the Pennsylvania Department of Health in our region only tracks communicable diseases. And I've emailed some information, that you can, if you're interested in, about the heat vulnerability index. Workplace safety meeting took place March 6th. No injuries or near misses were reported. Katie attended the Delaware County Local Board of Health meeting March 1st. And there was a rep there from, I guess, Delaware County. It's their Crisis Connections. It's called Delaware County Crisis Connections. Basically, they have kind of two teams. One's for crisis situation, one for like less critical. So under the mobile crisis team, they basically have a group of highly trained professionals who can kind of go out into the county to assist in crisis situations. And then they also have the, I guess it's called the warm line. So that's for kind of less critical services. You can call in that number that's listed there, and someone will assist you in finding, whatever you need. I emailed the alerts. If anybody has any questions, just let me know. Thank you.
Marie, could you step back? You said the Delaware County does not track diseases,
Yeah.
period.
Yes.
What was the second part of the sentence about communicable diseases?
The Pennsylvania Department of Health.
Got it,
Our
okay.
local region, only communicable diseases.
Thank you.
While we're on that, though, Delaware County did promise West Nile surveillance. They're surveying for mosquitoes and for presence of virus, but they are not tracking epidemiology of disease. Is that what I'm understanding you to say?
Correct. I don't think you were here for our last month's meeting. There's some information, or a discussion was started about extreme weather and worsening symptoms or diseases that can be worsened with that extreme weather. So question came up as whether or not we track any of these diseases.
Just to clarify, thank you for the information around the warm handoff and the Delaware County Crisis Connection. So how do we as residents, or who activates that? How does that occur? I don't want to put you on the spot.
I'm going to let Katie talk.
Okay.
She was there for that meeting.
All right.
The warm line is you just call, and I'm pretty sure they were people who have gone through similar issues, and you just talk them through it, and it's just, yeah, non-critical, like Marie said. And then the critical line, you call, and then they send a crisis team out to your location.
So would that be some kind of police event or neighborhood event?
No, so it's like if you have, if you want to call on one of your family members or your neighbors, or you can call yourself, and they kind of, I think they work with the police, and they keep in touch with you. So at any time, if, you know, if I call on, you know, a family member, they keep in touch to, if it gets to a certain point, to call the police. But sometimes the police will be there already, and they do like they test you and give you certain resources that you can go from there and what you need to do.
All right, thank you very much.
So just to clarify, it's the Pennsylvania Office of Mental Health, and worked with Elwyn to put this program together.
So at this point, this is all informational. There wasn't anything that came up last meeting or in between that suggested there was something that at a township level we have some need or obligation to act upon. Is that correct?
Regarding the crisis support?
Well, regarding disease tracking, crisis support, foul weather risks, and so on. Is there something that we need to dig into, or are we comfortable that things are at the township level, that we're okay and we don't have something new that we need to turn over?
I don't really think we got that far into the conversation.
Okay. Thank you.
So it seems like a great resource, and I'm sure Governor Wolf has put a lot of money and funds into this. So would this be on our website for the community to be able to see or access?
Yeah, I actually think the police department, they alerted us to this program a while ago, maybe a few months ago. So I think that they posted it on their website or their Facebook page, but I can certainly make sure that both these, the number and a little bit of information that the county gave us is posted on the website.
Okay, great. Thank you so much. Thank you. All right, any other questions regarding that? Thank you for that follow-up and report. All right, some old business. So I haven't heard anything back from the Ready for 100 initiative. I know it was approved, but I haven't heard any next steps. I don't know if anybody else has heard anything.
Just it was approved.
It was approved, so I'm sure more to come on that. Okay, and then also the gas leaf blowers was forwarded to the Board of Commissioners. I haven't heard any follow-up on that. I don't know if it's on the agenda tonight.
It's not on the agenda, no. And I don't think it is for the next meeting either.
Okay, so should I forward that again to attention Commissioner Nagel, or?
I think that this comes up every few years, this topic, and they discuss it, and I think right now, just from the conversations that I've had, that they weren't, there wasn't a plan to adjust the, I guess, the enforcement times, since right now the police department is the one who's enforcing it, so they didn't want to right now take the kind of police off the streets to kind of enforce that kind of thing right now. So that's all the information that I have on that.
Can you remind me, our recommendation was consistent with current ordinance, or were we recommending that the township undertake new ordinance?
We were recommending quiet time extended, and we were recommending on a complaint basis that people be using newer equipment.
But so current ordinance would have to have been modified to fulfill the recommendations that we made.
Mm-hmm.
And if I'm understanding what was said, right now, pulling police off of other duties did not feel appropriate, but I would virtually guarantee that the level of noise of the residents of the township will dramatically increase over the next several weeks. So do we sit on our hands and watch the commission, or do we push the commission to execute against the recommendations that we made, or explain to us why they were not appropriate recommendations?
I think the appropriate thing would be to ask our liaison commissioners what will transpire, what did transpire. But the other thing is, since they have passed Ready for 100, there's a confluence here of issues, so, you know, right, so maybe it won't stay hidden for long.
Well, so it's not hard to understand why people would think it's not terribly important to enforce gas blower ordinances in December, January, February, and maybe March, but pretty soon, I think that there will be a shift in the weight of the attention just for the noise factor. I mean, and I don't think people necessarily appreciate. It was new to me, but pretty apparent when you looked, that it's not just noise, that if you ran your car on engines as efficient as the gas blowers, we wouldn't be able to breathe the air in the township. So I think, I agree with you, let's see what the commission asks of us, but I think we should make it clear that we think it's an important initiative and is aligned with other initiatives like the Ready for 100.
I can certainly follow up with an email to Commissioner Nagel to see where we are with this particular issue. So, yeah, I haven't heard anything.
I mean, I think it's pretty unfortunate if we make a recommendation of that sort, that it just gets ignored for months on end. You know, some of what we were asking or recommending was hardly onerous for the users of these machines. So, yeah, I do think that if the commissioners are choosing to ignore the recommendation or not act on it, it would be really good to hear their thinking on why not.
I agree. It would inform our future deliberations around things. I think I raised the ordinance question because I think there are two steps. If there is an ordinance required to get to what I think was not a very aggressive policy, that is, say, 11-year-old devices that were built at a time when technology was different should be kind of eased out of the township. If an ordinance is required, I'd like the support of the township or an understanding of where we overstepped our boundaries. Enforcement on the part of the police department is a different story. If they're busy taking care of robberies and murders, okay, maybe the gas blowers aren't so important. But again, I think that the will of the residents of the township will probably shift over the next few weeks, and an understanding of enforcement is one thing, ordinance is another, and if an ordinance is necessary, I'd like to move to get the ordinance, and if not, understand where we overstepped.
Okay, so I'll definitely reach out and find out, and I think your point's well taken. I mean, it's winter and spring's upon us, and we're definitely going to be hearing it more. Okay, moving on, update on student projects, Teen Health Week, anything to report?
Yeah, Lewis and I drafted a few new tweets. I have a few right here, but I don't have his because we kind of divided the week. Yeah, do you want to go over
Do you have,
a few of them? Yeah, so for the violence and mental health, well, what we did is found the topics and then found relevant articles. So then we kind of made an attention-grabbing tweet and then linked that article with it. So that's mainly what we've been doing. And for example, Saturday, April 6th, community-specific teen health, we chose the topic of vaping. We said teen brains are especially vulnerable to the negative effects of vaping. It's not only dangerously addictive, but also appears to result in serious psychiatric symptoms. And to learn more, and then we posted a link. Yeah.
That's excellent. I like the article, so it's evidence-based information. I also forwarded you something from Dr. Laura Offit in terms of what she has tons of resources, and I'm thinking some of those articles are linked at the bottom of the webpage. I don't know if you had an opportunity to take a peek at it.
Yeah, one of those articles I think we did use. Yeah.
That's great. So you can definitely use some of that. That's great.
It's actually a really interesting topic and comes back to our role at the township level. So obviously regulation is federal and legislation is at a state level, but are there township ordinances that define where one may or may not smoke cigarettes and where one may or may not therefore vape? And is this a topic that we need to bring recommendation to the Board of Commissioners again on? Is it something that's new and percolates to the surface?
Funny you should mention that. We did spend a great deal of time a few months ago on the issue of smoking in public spaces, and met with some considerable resistance on the basis of government intervention in personal freedoms.
Wasn't there an enforcement issue as well? Like who was going to, right,
Yes,
police,
that was
for lack
part
of a
of
better
it.
term, police it?
Some of the things we considered is limiting smoking in our recreational areas and parks, playing fields, near playing fields. We considered trying to have a particular space in the public parks where you'd have to go stand to smoke. We considered, could we limit smoking on the streets if in fact there are outdoor dining venues where smoking is permitted, those kinds of issues.
We don't really have, at this point, a sense for the population of the township whether people are satisfied and okay, or whether there are, have concerns percolated to the surface about smoking in public spaces that is potentially injurious to the non-smoking folks. Is it an issue, or are we making it an issue, is the question.
That was one of the concerns. How do you measure the issue, rather than looking to see what the litter is, maybe the litter of the cigarette debris? How do you figure that out? No one's come here and said, we have an issue.
But so my understanding, I think in the state of Pennsylvania, is that unless it's a private club, restaurants are all non-smoking, which feels like pretty significant government imposition, whether you favor it or don't favor it. I'm all in favor of that. But I think two different things. Do we have a further need to act? And right now, I don't feel like as if we here believe we have a further need to act. It might come up. But the additional question, though, is there something about the topic being raised about vaping? Is vaping distinctly different from smoking? And do we have a need for a township policy around vaping is a second tangent? And again, if there's been no percolation from the electorate of the township, okay. But I think it's something that we should keep in line of sight, because for the same reason that we now are aware of dangers of vaping, it has perhaps fallen through the cracks with regard to local ordinance and local regulation.
I can tell you one thing. We take complaints in our department from the community, and in the last 2 years, I can tell you we've had 2 smoking complaints, and I remember them specifically, and that's it. And neither one of them were vaping related, and I know it's, this is a new thing, but yeah, one was an apartment complex. They were dropping the cigarettes off the balcony. That's it. Right, exactly. So, and the other one could smell it through the walls, and they're the only 2.
As I recall, we actually drafted a recommendation to the Board of Commissioners on this issue. But in looking at some of the state legislation, Pennsylvania had, I think it was the Outdoor Clean Air Act or something like that, that appeared to limit what the township could actually do. So as much as we would all like to see less smoking, there wasn't a whole lot we could do about it, was the conclusion.
And that's definitely true. And I presented a talk last spring with Superintendent Flanagan on vaping specifically, and looked at the carcinogens and chemicals and that sort of thing. I looked at flavored vaping and nicotine vaping and those sorts of things. So there's all kinds of hidden chemicals in it, but the exposure around other people is still, to be determined from the literature. for the moment, we're watching.
Well, the vaping is a whole nother issue. I think the FDA is going to take the lead and do something, finally looking at what's in the vape, what they're putting in the vapors, yeah.
I know the flavored vaping's being looked at specifically, so, you know, what's in
I
it.
think they've banned it all except menthol, believe it or not. Menthol's okay, orange not.
Okay, well, thank you for the update on the Teen Health Week. Much appreciated. And so we're in March, so April, so before our next meeting, maybe you could just email me an update, and then at our next meeting, you can tell us how it went. You were going to do Twitter as well? Okay, and the school Twitter account?
Yeah, we're planning on contacting that actually not the school Twitter account, the Radnor account.
Oh, Radnor, that's what I meant. Yeah, great. So it'll be interesting if we can query how many people retweeted, that sort of thing would be great. All right, thank you very much. I guess we touched upon the West Nile virus surveillance program follow-up, so we just mentioned that?
I think we're status quo there. The county has maintained responsibility. They've changed vendors with regard to the actual action, but their intention is to have the same level of surveillance and the same a website availability for understanding what's going on and what plans are around it. So I think it's county level, and we continue to watch.
Thank you very much. I really appreciate that.
Do we know who is taking over from Penn State?
I bet you Marie remembers who it is, but I don't remember who it is. It is a private concern.
Did we get confirmation who was taking over? I didn't think we did just yet.
Well, the season starts in April, right? So a couple of weeks away.
And we
At the-
assured that they intended to continue without an interruption of service. And I'm looking for my notes and not finding my notes on.
Oh, go ahead.
Sorry. At the Delaware Intercommunity Health meeting, they did say they're still interviewing for somebody. So they're still trying to find someone.
But they did confirm that the gentleman who was assisting the Penn State, the guy running the Penn State program, is still here and will still be involved. So there is going to be supposedly somebody who's very knowledgeable about the process still here. That was the last word that I got.
What does that mean, still here? Is he in charge of the project?
So it was a one-man show. Jeff Way
Jeff
from
Way,
Penn State.
but he had
And then
he had a couple of other helpers, didn't he?
He had
Three
helpers
helpers.
to retrieve the traps, bring the stuff to
Right.
him, help with the spraying. And it is my understanding that that gentleman or those helpers or assistants are still here
Okay.
and will still be involved.
And what about Jeff?
No, Jeff is no longer. I do not, and that I believe is what Katie was saying. They're still interviewing for the actual, who is going to actually run the program.
And the runner of the program will be employed by who?
I have no idea.
Delaware County?
Delaware County, I'm pretty
Delaware,
sure.
okay.
So while we're on it, I believe that Delaware County will be responsible for assuring that a program is run. I believe that they will be contracting the service. So who's actually doing it will be paid, I would think, indirectly from Delaware County by whatever service they contract for. So it doesn't, I'm with you, it does not feel solid right now, but I think that our obligation is just to stay on the county and find out what's going on. I don't know that we can push it any harder than that.
Okay.
All right, thank you very much. Where to follow? Okay, so Dr. Carabassi, we reviewed your survey of the schools in the area, and I didn't know if you wanted to give an update on the mental health services provided at various schools throughout the township was outstanding and eye-opening, so I didn't know if you wanted to shed a little more light on that.
Sure, I can just do this in a mini presentation. It was an informal survey of present school-based suicide prevention programs and initiatives in Radnor Township, public, private, and parochial schools. And it was completed in February of this year. A little bit of the background, In 2018, there was youth suicide in the community, and that prompted Police Chief Chris Flanagan and Commissioner John Nagel to reach out to the Board of Health just for some information seeking on what is going on in the township in this time, present time, regarding any kinds of initiatives in suicide prevention for our students. We discussed it at the board meeting, and I volunteered to, with the task of finding out exactly what's going on in these schools. Marie had given me the name of a contact with the Radnor Township School District, which I contacted her by phone, and then I did an internet search of schools that are located in Radnor Township. That generated 12 schools, and I wanted to include just schools that were either upper and middle schools or middle or upper schools, no just grade school or lower school students. And that generated 11 schools. I contacted each of these schools by phone, just cold calling, just spoke to the receptionist and identified myself, explained what I was doing, and asked for the person that they thought would be responsible for their programs. And so overall, I got a very good response. There was only one school that did not respond to my several calls, and after 3 or 4 phone calls, I said, okay, I guess they don't want to get back to me. Except for the Radnor Township School District, in my report, I've kept the anonymity of all these schools. They're just identified by Radnor Township School District is considered School 1. Every other school is considered School 2 through School 11. I also included in the anonymity of these schools, the 2 schools that were not in the township, and you wouldn't know which ones they are. So I think that they're pretty well protected. I also changed some wording so that it would help to further preserve the anonymity of the schools. Summary of findings is pretty much all of the schools had some level of suicide prevention initiatives in place, some much more than others. I was very impressed with Radnor Township School District. They have an amazing program, and they're very much on top of things. Many of the schools utilize public resources, national resources, local resources that they implement into their programs. Most of these resources try to help the students to feel safe and able to come forth to to adults and feel like they are not going to be ostracized in any way. And this works for both the students that are considered suicidal as well as friends of the students, that they feel that they can come forward and be safe in reporting any kind of thing. I have lists of all these different programs in my addendum in the report, which I'm sure you all have read, so I will not mention those. I will make a note that several of the schools did request more information regarding the suicide prevention, and they seem to be very receptive in our reaching out to them. And so we thought that maybe in the future we might do a presentation, which I will discuss in a minute. Just back to the report, it's important to remember that this was an informal survey, so we can only draw generalizations from it. We can't say, okay, this is exactly what's going on, because it was a discussion that I had with each of the schools, and you know, no specific scientific methodology was involved. Now, having changed the report to include anonymity, I'm asking the board if it would be possible for me to send a copy of this report to each of the schools, because they did, most of them did ask for it. So if it's okay with you, you reviewed it and feel like their school identity is protected, then I would like to go forth and send these to them. Everybody okay with that? Okay.
I think that's great to send it to them. I'm still not sure I would put that part of it on the website, but I think that list of resources
I fully
is
agree.
phenomenal.
I do worry
And I would
about, I'm not sure if I'd want all this. I don't know. Does anybody concur? I think the resources are outstanding. If we could just bullet point the resources.
And send that to the schools?
Correct.
Okay, that's
Okay.
fine.
I
I
have
don't know.
another question,
What do you
though.
feel about that? Because, I mean, I could pretty much figure out what school was what.
Okay.
I could.
Maybe then just the conclusion, conclusion and.
Okay.
That's a good idea. You could do the up through the findings and then the conclusion, and that's, up through, wait, I don't even, you could just do up through the findings and not list the individual.
Okay.
And then add the conclusion.
Right, so I can do the background participants method and skip,
And findings.
right,
Skip-
okay, but
and then-
skip all the school.
And then
or-
put conclusions, yeah.
Okay, sure.
We use something in our work environment called SBAR, so it's a situation, background, assessment, and recommendation. So it sounds like we're all thinking the same thing, but
Synopsis of what the situation
Okay.
yeah, the background, just as you presented,
generalized findings.
Right.
Yeah.
Okay.
and
So
recommendations.
what I'll do is, I'll write that up and send it to everybody for your approval, and then upon approval, then I'll send it to,
Okay, and I
Each
would
of the
ask the
schools.
support of, if everybody just gives me, input before
Okay.
that's forwarded out.
Sounds
I'd
good.
really appreciate it.
But I do have a question.
sure.
Because Radnor is so well-resourced in this area, Radnor Public Schools, and other schools are not, does Radnor have the ability to be a resource to private schools? Do we know that?
It's a really good point, because it's taxpayer dollars,
Right.
and, are we not entitled, but should we have that opportunity to share that? I know my child's gone to private school, and I have called Radnor for specific testing and different things like that over the years, which I was
I'm
able to
not
have.
sure who would it be that I could find that out from?
Well, the question came out, what does the police department want to do with this information? Like, what is their goal, end goal?
I think it was general information seeking at
Okay.
that point. I think, in consequence to that tragedy, they said, okay, what is going on in our township? Is there anything at all going on? Because they didn't know. They
Okay.
just didn't know. So now they have that information. But moving forward, we thought that maybe at one of the Board of Health meetings that we could have a presentation by
Absolutely.
one of the counselors from Radnor Township School District.
Absolutely.
I've called her, left voicemails, emailed her, and I've not been able to get a hold of her yet. She did express interest. The only thing she said, she needed to speak with her colleagues and had a few questions to ask me before she committed. But along those lines, if we got somebody to do a mini presentation, nothing huge, invited these schools to come, as well as the community, maybe that would be a start. And maybe that would introduce Radnor Township School District to start a dialogue with these other schools. I did suggest May, because May is Mental Health Month, Mental Health Awareness Month, and so I'm just waiting to hear back from her. I had wished that I could have given you some more information about that, but I just haven't heard back from her yet.
So at this point, they're not seeking anything else from us, but just this gathering of resources that so the township can have, the police department
Yes.
specifically can have this resource list?
Yes.
Okay.
So can I understand, you're going to streamline the report for publication where?
Now, to send it to each of the schools that I surveyed.
So I'm a little hesitant to volunteer the township to become a clearinghouse without the township buying in, and maybe we should invite somebody from the township here to have that discussion. So if I can lay out what I'm hearing, having missed, I'm hearing that the Board of Health of the township has reason to be proud of the fact that our school district has what feels like a robust suicide prevention. That you've done a survey, and your survey suggests that there is more heterogeneity among the non-township schools, but that there are a lot of resources that you've uncovered. So I think that we should be a little circumspect without involving the township for recommending that the township do anything unless they volunteer to do so, but that sharing your report without recommending the resources, but sharing the availability of the resources sounds like something that we can do as we move forward to understand, is there more of a role of the Board of Health in the township? Is that
So just as a point of information, there is a Radnor Township School District liaison appointed to our committee. They're
Correct.
just not here today. So we would, of course, we wouldn't jump over them.
And this, just to clarify, these are schools in Radnor Township.
Right.
Some of them are private. So they're all township.
Right, but this is a collation of tools that are available.
To all the schools in Radnor Township.
Right.
Correct.
So there's no.
And to many schools around the country as well.
Correct.
But I just need some clarification. So what you're saying is that if we invite this particular person to come in and speak on behalf of Radnor Township School District, that she would need to get some higher power to okay it?
No, I'm saying that we are not in a position to offer Radnor Township School District's resources in a broader level than they are already offered, but they may wish to. The idea that I heard was, well, should we offer, since
It was a question.
Right.
It was just a question. I didn't offer them. I just wanted to
Understood,
know,
but
is it possible that township resources can be used for taxpayers who are in private institutions? Just a question, not a volunteer.
Right.
And we would have to ask them, and we do have a member who usually is with us.
So we can either
That's what I
not,
heard.
or
I heard
we
that
can
as
either
well.
not do anything, or we could involve the school district and move forward with what sounds like a reasonable idea. If there's a sense that we need to do something, then I would involve the school district.
Right.
Make sense?
Yes, and all of these resources that are in the addendum are not Radnor Township.
Right.
They are local, city, state, and national. So these are not specific to Radnor Township. They utilize these resources, which other schools might not even know exists. And in one school in particular that I surveyed was really anxious to get more information.
And I think that's completely reasonable, to give them right now the information. I mean, we don't want to wait months and then find out if we can use the Radnor Township School District resources, that, we can
Right, but
certainly follow up.
Oh, so what you're saying, so what you're saying is that we can't say specifically what Radnor Township is doing? Is that what the school district is doing? Is that what you're saying?
I think, I mean, I don't see why not, but we couldn't offer that right now without approval.
No reason we can't offer up the information we have about what the township is doing. I just don't think we can offer township school district services to private schools without the town.
I'm somewhere that maybe I was misunderstood. Never intended that, other than to say that we would like, I'm reaching out to her to see if a presentation could be made at a future meeting that might include these schools and the community, and teachers and anybody else who wanted to attend. But in no way was I offering their services, because that's,
Right.
no.
And I think that's it would be wonderful to have a presentation like that. My only concern with, if we have public participation, we may need some counselors or people available, if they start talking about this, have resources available at that time as well. So we can definitely revisit it, but it is Mental Health Month in May, so that would be a perfect time.
So let me just summarize. We're going to send out the report addended to the schools.
Correct.
Without identifying the other schools. Take all that information out of there.
Basically, I'm going to take out anything
School
that
2,
states
3, 4,
Radnor
right.
all the way down to
Right.
school 11. That all gets removed.
And then try to get the speaker here in May from the counselor from the Radnor Township School District in May to further explain more detail about the program.
Or just open a discussion.
Open a discussion about-
So that the other schools that are attending could get more information.
And make the connection, network.
Right.
Okay.
Right.
I really like that idea. I think it's wonderful, and we could publicize it on the website itself and then invite other schools. It is a really hot topic. You know, in my
It is a hot
healthcare environment, we've definitely seen a lot of suicidal ideation, and it's frightening.
There's one township in the region that had a number of, over time, a number of suicides. If I had to guess, the timing of our being asked to be involved was when the local news picked up that one township had 2 in a week and 5 in like 14 months, and it had become a topic of concern. And I think it's great that you did the work that you did. I'm relieved that we have a school district that appears to be well prepared, and if we can enable a broader preparation, I think that's great.
I think that's one of our missions here on the Board of Health, and really to disseminate pertinent information and bring the community together and
Exactly.
have those available resources. So I commend your work. That was
Thank you.
great.
Not to add further confusion to this issue, but there are other resources in the community that are involved in suicide prevention specific. I'm thinking mostly of churches, frankly. Would we want to reach out to them and invite them to present whatever they're doing, or just sit in or whatever at the May meeting? Kind of make the whole.
That'd be great.
Okay.
So I guess next steps, you'll send it out to me, and then if you would continue to work on possibly getting somebody for the meeting. Okay. But reach out to me as well. But request, so I can help facilitate as well. So, thank you. All right, thank you so much. That's great. All right, so on to some new business. Okay, food safety, and Catherine was going to give a update on this.
Hi, everyone. Is that loud, or is it good? Okay. I'm Catherine Carlomagno. I'm the health inspector here at Radnor. So I just put a little presentation about food safety. There's a lot more than what's on this presentation, just a little bit. So first, what is a foodborne illness? It's an infection or irritation of the GI tract from a food or beverage that has been contaminated by harmful bacteria, parasites, virus, or chemicals. Most common symptoms everyone is familiar with: vomiting, diarrhea, abdominal pains, fever, and chills. Most of it is acute, occurring 24 to 48 hours. Sometimes it's longer and could require hospital stay. The CDC says that each year, 1 out of 6 Americans will become ill from a contaminated food or beverage. It's responsible for 3,000 deaths each year in the U.S., and it's an estimated $15 billion spent on foodborne illnesses. I thought this was kind of interesting. It shows the different microorganisms and the difference between in the United States and outside of the United States. So I'm sure you've heard of some of them in the United States: norovirus, salmonella, Clostridium, Campylobacter, and then Staphylococcus. And then outside the U.S., typhoid fever, cholera, E. coli, hepatitis A. The top reasons why food becomes contaminated: improper hand washing, cross-contamination, inadequate storage or cooking temperatures, sick or infected food employees, incorrectly cooling or reheating food. Other ways food can become contaminated: a dirty, unkept establishment, lack of pest control, improper hand washing of produce. So the CDC lists the top foods linked to food-related illnesses: raw meat and poultry, fresh produce, raw dairy products, raw eggs, raw shellfish, raw flour, and sprouts. So a foodborne outbreak is when 2 or more people become infected from the same food or beverage. Those who are included in determining the foodborne outbreak is epidemiologists, health officials, doctors, nurses, and then on the state level, CDC, FDA, USDA, and the PDA. So I wrote down the steps to how to determine a foodborne outbreak. So the first is the epidemiological data. So you go back to time periods, common foods consumed, common restaurants, grocery stores, or an event. And then you trace back, so you find the point of contamination and identify food safety risks at the restaurant or grocery store where people became ill. And then there's food testing of the contaminated source to find the microorganisms that match the ill patients. And this was just a diagram of all the steps to find out a foodborne outbreak. And you can see this on the CDC as well. And then these are just some of the outbreaks that occurred in 2018. The romaine lettuce happened, I think, twice. In that one, you can see there was 5 deaths. So the other ones, there wasn't any deaths besides the chicken salad. And then everyone as consumers, if you get sick or feel ill, to call the Pennsylvania Department of Agriculture or online, or call your local health department, talk to them, and most important, be specific as possible. So go through symptoms, time periods, where you went, what you consumed, if you were with somebody that consumes the same thing, if you went to the doctors, what the doctor said, just to help out and keep on record, even if it's not a foodborne illness or it's from somewhere else. So the health inspector role in food safety. So we inspect the restaurants once a year and then the schools twice a year. And we go into them again if there's complaints or if they remodeled, have a new owner, or if the closure of the facility warrants us to go in again another time that year. We also generate the food safety inspection reports that are all available on Radnor Township website, as well as the Department of Agriculture. So in Radnor, if you go in the food establishments, you should see a sign saying that they're available upon request. So they should be there if you want to see them, and they're also online and on our township website. So some of the most important things I look for during an inspection: proper hand washing, temperatures, and make sure they're sanitizing, know how to check the sanitation method. Look for general cleaning, look for personal hygiene, make sure they're wearing hairnets, they have clean clothes, and then I educate the staff on food safety practices. And these are only some of the things we look for. This is how to prevent foodborne illnesses at home. So it's important to know that it's not only at restaurants, that it can happen at home. So when you go into a grocery store or food market, make sure it's clean and looks okay to purchase items from there. Don't purchase any damaged or bulging cans or any ripped or torn bags. Refrigerate or freeze items immediately after returning home. Wash hands frequently and when appropriate. So when you're, changing from raw food to cooked food, and in between cooking, separate raw and cooked food items in the fridge. Also separate utensils used for raw and cooked food. Thaw frozen foods correctly. Don't place them on the countertop to thaw. Keep a food thermometer handy to check cooking and storage temperatures, and then reheat all food items to a minimum of 165. And then this is just a little quote that food can become contaminated at any stage in the food chain, including at the farm, during animal slaughter, during processing, in catering kitchens and restaurants, or at home. Keeping our food safe relies on the efforts of everyone involved in the food chain. And that's it. Thank you.
That was great. Just a couple questions. So when you go into an establishment in a township, I guess do you go announced, unannounced?
Unannounced.
Okay, and so you're looking, I guess, initially visually at the restaurant, and then going in the back and looking at food and how it's stored. And do you temperature monitor?
Yes. So we have an infrared thermometer and then a stick thermometer. So we look in all the fridges, look at the food that's out and they're preparing, take temperatures, look under all the equipment, make sure the equipment's clean. just watch them a little bit, see when they're cooking and washing hands and changing gloves, things like that.
Say they didn't wash their hands, they get like, I guess, a strike or whatever. How many like things they have to get before they're like on condition or?
It's really not anything specific. It's kind of just how the situation goes, if that makes sense. It just maybe multiple critical violations, or, you know, you just see a lot of things going wrong, or it's just been multiple times it's been happening. So it's not anything specific that you say this happened, so they have to be closed.
Give them an opportunity to come back and re-inspect? If
Sometimes,
you gave them
yeah.
a written list of specific things that you
Yeah.
noticed during your inspection and then come back for re-inspection?
Right, right. The food report is separated into two parts. So the first part is critical violations. The second part is more like good retail practices. So critical violations warrant us to go back for a follow-up unless they correct it on site. But that would make us go back for a follow-up. That would be more like on the building code side. So things like, you know, they're making a ready-to-eat meal with their bare hands, or seeing them not wash their hands, or other critical violations, temperatures. So, yeah.
Thank you very much. Anybody have any
I have a
questions?
question. Do you test the surfaces that they're working on, like to see if there's any kinds of bugs that shouldn't be there? All kinds.
Unfortunately, we don't have those those products to do that right now. No, so we don't do that. But we make sure they have like a sanitation method that they're using to wipe down the countertops and clean their dishes and whatnot. And they have to test it.
And you just do like visuals of the refrigerator and the freezer, just make sure that doesn't, and no green things are in there or along the walls and.
Yeah.
Okay.
Thank you very much. That was excellent and
Thank you.
extremely informative.
Thank you.
So every restaurant, did they get an inspection every year in the
Right.
township?
Right,
Okay.
unless there's a complaint or, you know, a new owner or remodel, then we
Right.
would go in again.
So if one of the residents noticed something that was unfavorable, they can just call?
Yep, they would
The
call our
township
department
and
and
make a
we would go
complaint.
out there and do a quick inspection.
Okay, good to know.
Okay?
All right, thank you
Thank
very
you.
much. It was excellent. Really appreciate it. And that wasn't just a little presentation. It was very, very thoughtful and excellent. Okay, so moving on to upcoming Board of Health presentations. So next month is, well, this month is actually Colorectal Cancer Awareness Month, but Dr. Khanna could not be here, so he's going to present next month. We were looking at something around Alcohol Awareness Month in teens, so I didn't know if anybody had an interest in maybe giving some information on that. If you want to, let me know. In May, Stroke Awareness Month, I have a interventional neurologist coming to talk from Mainline Health about the neurointerventional program at Mainline Health, and a little bit about stroke awareness from one of our nurses. And we mentioned mental health awareness, so maybe Dr. Karabassi, we could talk offline and maybe bounce around some ideas, which would be great. And then in June, our student interns are going to give their presentations on sleep, correct? Teen sleep, which would be great. So anything else? Anybody else would like to present? No? Okay. I just wanted to mention the flu is in its final stages of flu season, so we have seen a drop-off in the past 2 weeks on flu, and flu A seemed to be very rampant this year, although the flu season was not as severe as last year, although it felt it in the hospital, especially around pediatrics. So it's coming to an end in March. And then the last thing I wanted to say is Dr. Schartz-Hopko, it's your last Board of Health meeting. So you've been on the board for the past couple years, 2 years, a little over 2 years, or 3 years, thank you very much, 3 years. And you've given presentations on sexual violence, crumb rubber on turf fields, gas leaf blowers, and women and heart disease, and we wanted to thank you for your leadership, expertise, and input and support on the board, and we can't thank you enough. And we're
Thank you.
going to miss you very much.
Thank you. It has been really an honor to serve. Thank you.
Yeah, thank you so much, and you've been wonderful, so it's been really great to have you on the board. All right, out of Township. So good luck on your new journey and road ahead. Miss you very much. Okay, any public participation? No? Okay.
Sarah.
Hi there. She's waiting for the commissioners' meeting. Okay, so if we have no other comments, we're going to end our meeting. Adjourn it. Thank you very much.